We are back! That's right, we are back. This is the Ethnic Health Disparities podcast show. Sorry about that. I'm going back and forth. I'm sticking with the Ethnic Health Disparities podcast show. I am Dr. B. Welcome back. This is show number 14. Show number 14. It's entitled New Cultural Health and Medical Framework. That's right. New Cultural Health and Medical Framework. I'm going right to it. That's right. This is another podcast show related to the CDC's mortality and morbidity article entitled Vital Signs, Racial Disparities in Age-Specific Mortality Among Blacks or African Americans, United States, 1999 to 2015. Published May 5th, 2017. And the reason why I titled this particular show, show number 14, New Cultural Health and Medical Framework, it's desperately needed. Because in the last show, show 13, I talked about researchers' bias. So now it's time for a new cultural health and medical framework. That's right. That's the title of this show. That's the reason why I'm going there. Connecting the dots, taking the next step, moving on from the issue and just providing a new direction. And that new direction is new cultural health and medical framework. That's right. If you have any questions or comments, please email me at ejb678@gmail.com. Check me out on iTunes. Download me on iTunes. Download me on Podbean. Download me on Spotify. Download me on YouTube. Check it out. Check us out on Instagram. And also Twitter. We're on as many social platforms as possible. Because I'm getting these podcast shows out on ethnic health disparities. Because again, it's obvious. It's still obvious in 2019. Researchers, scholars, research teams, research institutes need a new cultural health and medical framework. Now, what do I mean by this new cultural health framework? Let me just get back to this report. What sticks out again as I read this report again and again and again. Now, at the end of the article, they talk about the limitations. Now, this is very important, the limitations of their findings. And I'm just going to read this paragraph because it tells you something significant. Now, check this out. The findings in this report are subject to at least 6 limitations. First, information about many characteristics were self-reported and subject to recall and social desirability biases, although this is unlikely to account for the large disparities within the analysis. Second, this was a cross-sectional analysis and data do not allow a comparison of rates for the same cohort as they aged. Third, the American Community Survey and BRFSS are household surveys and exclude persons living in institutions, long care facilities, and prisons. Fourth, there are technical and conceptual limitations associated with examining race in epidemiological analysis because it is complex and generally represents other economic, psychosocial, and environmental factors. So race is, are they saying race is too complex? Hello? They're saying race is too complex to understand, to analyze. What? As much analysis researchers do, they just say, oh, race is too complex. Wait a minute. All this data analysis, All this regression analysis, all this sophisticated data analysis, the tools we have, we can't parcel out race at this point in time. Excuse me? Fifth, although whites were considered as the benchmark or referent in this analysis, blacks had lower death rates for unintentional injury and suicide in some age groups and lower prevalence of binge drinking. Interesting. That was not reported. So blacks had lower death rates for unintentional injury and suicide and lower prevalence of binge drinking. Another positive element kind of left out. Hello? And then finally, differences within blacks and whites by sex, socioeconomic characteristics, and Hispanic subgroups were not considered, yet might modulate some of the relationships seen overall. So, differences within blacks and whites by sex, socioeconomic characteristics, and Hispanic subgroups were not even considered. Wow. There you go. What do you say about it? And then they further say, now check this out. This is the very last paragraph. Optimizing health for all U.S. residents while also eliminating disparities remain an integral part of the disease prevention and health promotion activities. Although significant strides have been made in the United States the last 17 years, disparities still exist. No doubt. To continue to improve the health of the black population, there is a continual need to translate research results into effective, universal, and targeted interventions across the lifespan to inform action. Wow. That last sentence was so generic. Not culturally competent. Again, not culturally based at all. Very generic. And yet, again, just read each section of a major report like this. It will give you indications that they're missing the point. They need a new orientation. They need a new cultural health and medical framework. And what I mean by cultural health and medical, that is, include culture into your analysis. And culture is defined as a system of shared beliefs, values, traditions that are transmitted from generation to generation to learning. The 6 major cultural attributes are learned, transmitted by symbols, meaning to reality, integrated, differently shared, and adaptive. Incorporating these 6 attributes in your analysis would help to make this report culturally competent. But as they say, just in this of their limitations, they acknowledge that examining race and epidemiological analysis, it is too complex. And it primarily represents other economic, psychosocial, environmental. See how we get out of things? This is the best time to break down the issues of race and how it impacts health outcomes. We can't do it if we just take the time to reorient ourselves to a new cultural health and medical framework. But no, researchers don't want to go there because it's too complex. What? Too complex in 2019? No, too complex back in 2017? Wow. Come on now. We are in desperate need of a new cultural health and medical framework for all research studies on health disparities across the board for each and every group, each and every racial and ethnic population. We need a new cultural health and medical framework. Period. That's my call. That's my bias. Today and in the future, it's desperately needed at all levels, at the federal level, at the state, at the local level, at the local, each and every university, each and every college. You're getting your grants. You're getting your funding. It's time to switch to a new cultural health and medical framework. If you're analyzing specific racial and ethnic populations, it is time. It's not too complex anymore. It's too complex because what? It's related to researchers' bias. But now we got to get away from that. So I am calling on a new cultural health and medical framework for all research studies highlighting disparities, particularly racial and ethnic disparities. It is time. It is necessary. It should be a requirement. Hello. Should be a requirement. Again, when you read and break down these reports, these journal articles at the highest level, I am still amazed that they're able to get away with this. There's got to be a checkpoint. Well, guess what? The checkpoint is happening now. And as I get more and more of these reports, and as I get the time to go over these reports, and that's the reason why I'm doing these podcast shows, so everyone across the United States can see, hear, analyze for yourself. Again, everyone, anyone can break down these journal articles. I'm doing it for you right now, but I want you to Google some of the latest journal articles in public health, in medicine, in nursing. Every discipline that does health disparities, Google them. Anything that's health disparities, review it. Does it seem plausible? Is it culturally competent? Does it have a cultural health and medical framework? Or is it a standardized reporting? And what I mean by standardized, straightforward, analytical, but doesn't bring any culture, doesn't bring any perspectives of the population. That's what I'm getting to. We need a new cultural health and medical framework. So you do the Google. You do the Google the articles. Review the articles. Review the findings that we often hear on major news magazines or news channels, on national news. Pull up those the reference articles that come across while you're going through your iPhone. You're analyzing different articles, news bits on your phone, which a lot of folks spend so much time on their phones. Just re-examine them and look at how it's reported. What are the limitations? Are they fully giving a well-rounded analysis to their disparity reports? If not, demand that they take a new cultural, health, and medical framework to their research studies and particularly their analysis. Come on, folks. We don't have to take this anymore. We do not have to take this anymore. Researchers, research institutions, agencies, funding agencies are responsible now to reorient them. And I have to admit, there's been a great approach by different funding agencies that have brought in culture, such as the Robert Wood Johnson Foundation started a new cultural health movement a few years ago. The Department of Health and Human Services at the, I believe, the Office of Minority Health brought in cultural assessment, cultural tools, cultural competency tools. Doing an excellent job. So it is not just possible, but it is being very much implemented at major national research organizations and sponsorship. So it's out there. Yes, Google that too. Culturally competent strategies. Federal government. Robert Wood Johnson Foundation. Those are just a couple. And there's different institutes at NIH that does a very, very, very good job. May I say NCI, National Cancer Institute, does a very good job. Outstanding. Particularly when I was there. Of bringing in more cultural competency to their analysis. So there are agencies that are progressive, that are trying to stay with the trend or ahead of the trend. Well, we're always playing catch up, by the way, but at least they're making a strong attempt. So again, there is a need, there is a requirement, there is a necessity for all researchers to take more of a new cultural, health, and medical framework in setting up their research studies, completing their research studies, analyzing their research findings, and presenting their research findings in a culturally competent way. Hello. That's what is necessary. So when you, again, you can skim over article, go to the results section, and then go to where they have to report limitations of their research project. When you read that paragraph, however long or small it is, that will tell you that the research team is not culturally competent and they need a new cultural and health medical framework. Just read it. It will tell you a bunch. It will tell you a lot. And that's what stuck out to me when I read the limitations, when they presented the limitations of their research project. Wow. And this was published in 2017. You'd think that they would have done a check back in it was just 2 years ago. Hello. With these large data sets, of which they use mortality data were analyzed using CDC Wonder System, an interactive web-based tool. And the CDC mortality data are provided by the National Vital Statistics System. Come on. This is national. This is big data. And that is big trend now. Big data. Everyone's analyzing big data now. In 2019 and 2020. Researchers are able to get, there's new initiatives across the country They're able to get these big data sets now. Well, guess what? Yeah, they're analyzing. They're getting these research dollars to analyze big data. And yet they, and I say they, researchers, research teams, are not taking more of a new cultural health and medical framework. They're still going about analyzing this big data from their researchers' biased perspective. That is wrong. Like I said, that's my perspective, but I just say it is wrong. It's a new day. It's a new time. We need a new cultural health and medical framework at all levels. Again, I just make it as plain and simple. And again, this journal article is one of the phenomenal research findings in over 20 years. Over 20 years, 25 years. Phenomenal. And it's earth-shattering. Yet, it needs a new cultural health and medical framework. Simple as that. So there you go. This is the Ethnic Health Disparities podcast show number 14, entitled New Cultural Health and Medical Framework. If you have any comments or questions, please email me at ejb678@gmail.com. Download my podcast on Podbean, iTunes, yes right, iTunes, baby, Spotify, YouTube. Like us on, Instagram. Check us out on Instagram. And check us out on Twitter. So, again, I'm just bringing it the best way that I can. And want everyone to really slow down and better appreciate health disparities reporting in 2019 and beyond. That's what this show is all about. Peace out. We out.